Hi, I'm Jeannie Yang. I'm a professor in the Department of Health Behavior. I was born in Jacksonville, Florida, and raised on a Chinese vegetable truck farm. But my teen years were spent in Prince George's County, Maryland, right outside of Washington, D.C. in Oxon Hill. For my undergrad, I went to the University of Wisconsin at Madison, and I was a French major. After college, I joined the Peace Corps in Togo, West Africa, where I discovered public health. I also fell in love with my husband. And after Africa, we both came to UNC to go to grad school and never left. So here I am, and wanting to welcome you and just to say that what I do here is in the fall, I teach a course called Leading for Racial Equity, Examining Structural Issues of Race and Class. It's required in the fall for all of the students in the equity concentration, but it's open to other UNC graduate students who are in professional degree programs. And it's also open to community auditors. So it's a really nice mix of people from all the full range of the life course and from multiple disciplines. In the spring, I teach community competence, participation, and power, community-based participatory research, and the photo voice methodology. So this is open to all graduate students at UNC, also at Duke and North Carolina State University. You should know is that there's an agreement among these three universities for our students to attend courses without any extra tuition, and the grade appears immediately on their transcripts. So you should take advantage of this range of resources that you have at these three universities. For nearly 40 years now, I've been conducting community-based participatory research with rural populations of color in the South in the United States. My studies have dealt with pesticide exposure among migrant farm workers, HIV and STDs among Latino men who have sex with men, and among African American women. Also addressed cardiovascular disease and have especially focused on cancer, especially breast cancer. For the first 20 years of my research here, I really focused on the lay health advisor intervention, which is more to build on the strengths and the natural helping networks of historically vulnerable communities, to engage them in the research, but also to engage them in designing the intervention and evaluating it and co-authoring publications about it. For the last 20 years of my CVPR work, though, I have been focusing on changing the healthcare system. I found that it's very important, yes, to improve the capacity and the strength of communities and to build on their talents and gifts, to increase access to healthcare, to prevent disease and illness. But at the same time, what I found is that the healthcare system is not always responsive. In fact, it's never been really responsive to people of color. And so my last 20 years have been focusing on anti-racism system change interventions. And I've been working with the Greensboro Health Disparities Collaborative for the past 18 years. I'm a founding member of this collaborative in conducting these studies. And we meet every month on the second Tuesday from 6 o'clock till about 7:30 or 8. And I've had lots of students, undergrads, masters, doctoral, and even postdocs who attend these meetings. Several will join and really see how community-based participatory research operates and functions on the ground. And you can participate in the activities and the studies, co-author publications with us, write grants with us. And so we're always open, and the collaborative loves to have students come and be mentored by them. But just for you to really get to know us. So that's my work here, and I hope to see you and meet you in the near future. Thank you.